Okay, I've washed my hands. Do you consent to have this uploaded to YouTube unlisted so my professor can give me a grade on it?
I do.
Great, thank you. I've washed my hands. So what we're going to start with is we're going to start with your hands, okay? So if I can see your hands, and I'm going to inspect, your joints, and I'm going to inspect the metacarpal. And there's no swelling, there's no deformity, there's no tenderness. If you need to, does it anything feel badly? Okay. And then the metas, okay, and nothing there. Now what I'm going to ask you to do is to do some range of motion. Okay, so if you can push your hands up and your fingers down. Okay, and now if you can abduct and you can adduct, and that's for your hands. Great. Next, we're going to go to your wrists. Okay, so I'm going to look at your wrists, and I'm going to look at the other side of your wrists, and I've also looked at the other side of your digits. And that's good. And your ulnar, and your metacarpals. And then we're going to do a range of motion. Okay, so we're going to do, if you extend them and you do 90 degrees, and then you do 90 degrees, and then if you do this with your radial, and then downward for your ulnar, and you can do that side to side as well, but that's good. Okay, now I'm going to do the tinsel sign. So if you just turn your hand over, and you bend your wrist this way, and I'm going to tap on that. Does that hurt at all?
No, it doesn't.
Okay. And on the other wrist, does that hurt at all? And then if you can do this for me, and again, this is testing for carpal tunnel, and you hold that for about 30 seconds. Does that hurt at all? That's the Fallon's test.
It does not.
Okay, great. So let's move on to the elbow, okay? And we're going to inspect the elbow for any tenderness, for any nodules, for any deformity. Does anything hurt at all? We're going to look at the exterior surface of the ulnar. We're going to look at the radial with olecranon, the epicondyle. So the epicondyle on the lateral side is for tennis elbow, and on the medial side is for golfers or baseball pitching, and that's because of the wrist action on the ulnar side, okay? And we would do that on the other side, but I'm going to defer because there's nothing going on, and I think that we can get that. Okay, now we're going to look at your shoulders, okay? So I'm going to look at your shoulders for any, and I'm going to stay seated because I think it's easier for you because she almost hit her hand on the fan when we were practicing. So I'm going to just take a look at your shoulders, and I am going to be looking for any swelling, deformity, any nodules. I'm looking at the joint symmetry, and then I'm going to palpate, okay? And I'm going to look at the acromioclavicular joint. I'm going to look at the bicep groove, which is in here. The tubercle of the humerus, which is here. And then I'm going to look at the coracoid process, which goes down under the clavicle, and that is like a hook-like joint that is the clavicle that comes into the anterior portion. And then I'm going to look at the subdelta bursa, which I'm going to feel right here, and that's fine. Now I'm going to ask you to flex your shoulder to 180 degrees, okay, and that's all the way up, okay, and then you can go down, and then I want you to flex your shoulder to 90 degrees out, okay, and then backwards slightly, but by keeping your scapular, so backwards by about 60 degrees, okay. And then with your arms by your sides, okay, so if you come back to me and you put your arms by your side, like this, okay, and we're going to ask you to abduct one at a time, which is away from your body, and then I'm going to add 90 degrees, and then I'm going to ask you to come across your body, and that's adduct, which is towards your body, okay? And then I'm going to ask for you to do an internal rotation, which is to try to touch your scapular, okay? And then an external rotation, which is if you move your hand and try to touch your back like that, okay? And does that hurt at all? Is that bothering you at all? Okay. And then we're going to do what's called an arc test. So if you can raise your arm slowly, and when you get to, is there any pain at all at the 90 degree?
No.
Okay, and then slightly up, go to 180 degrees, Is there anything like that? And then back to 90, any pain?
No.
And that's to see if there's any rotator cuff damage, okay? And now we're gonna do your head and neck, and I'm gonna stand up for that, and I'm gonna move the camera just a little bit, and I would do it on the other side. I'm just kind of doing this for brevity as well. So if you can turn around, I'm gonna just look at your head and neck, okay? And, oh, nope, the other way. Sorry. So I'm gonna palpate your TMJ, so I'm gonna put my fingers at the tragus, and if you can just open and close your jaw, okay? And there's no clicking or anything, or tenderness, no tenderness?
No.
Okay, good. Now what I'm gonna ask is I'm just gonna palpate the sternoclavicular, the cervical spine, the paracervical muscles, the trapezius muscles, and then the rhomboids, which is back in between the scapular, okay? And then I'm going to ask you to flex your chin, your head down, and then backwards, okay? And then if you do a lateral movement, touch your ear to one side, and then your ear to the other, okay? Now, if you could open your mouth for me, okay, and how many fingers can you stick in your mouth? You should be able to stick 3 fingers, which is usually on the side. Okay, that's good. And then the next one I'm going to do is a lateral movement. So I'm going to ask you to move your jaw from side to side. If you keep your hip, there you go. And then I'm not going to do the Sperling's test on her because I don't know if she has any cervical or anything, but a Sperling's test would be if you tilt your head to one side, okay, and I would be behind you, and then I would put pressure on this. I think it's something like 7 kilograms to see if there's any, and that's one. And then if you turn your head upward, that would be the Sperling's test B. Okay. Now we're going to take a look at your feet and ankles. So if you could kind of move just the chair over that way a little bit, and then I'm just going to do it here because I think that's, no, hold on, let's move that down. Okay, there you go. Okay, so I'm going to be looking at her toes. I'm going to be looking at her feet to see if there's any swelling. I'm going to be then, there's none, there's no deformity, there's no redness, there's no nodules, there's no swelling, there's no edema. And then I'm going to be inspecting the toes. I'm going to be inspecting the toes for nodules in between. Actually, you have no calluses, which is pretty cool. I have really pretty bad calluses. And then we're going to do a range of motion. Okay, so if you can flex your foot, and I'm just going to support you under here. If you can flex your foot dorsally and then reverse, and then if you do a rotation of your ankle, and that's looking at the joints. Okay, and then I'm going to look at the malleolus, both the medial and the lateral malleolus. Does that cause you any pain at all? No?
No.
Okay. And then no nodules, no tendon, nothing like that. And then I would do, I don't think we have to do the other one. I think that's okay. So I think if you move over this way a little bit, although I don't know, let's see. No, I think we're gonna,
knees?
yeah, I think we're gonna do the knees over here. Okay. I think I'm going to have you lay down for the knees, okay, so I can look at them. Okay. And if you can just bend them at 90 degrees, and I think we can see that, yeah. So what I'm going to do is I'm going to be looking at your inspecting. I'm going to be seeing if there's any swelling, any nodules, any redness, and there is none of that. And then I'm going to be palpating, and I'm palpating the patella. I'm going to palpate the popliteal to see if there's any Baker's cyst. The sides, I'm going to see the movement of the patella. If you just move that down. Okay, and that's good. And I think we can continue here on that. We're going to do, so we're going to do the external, I think I need to have you sit down to do the external rotation. I think that's actually a better thing. Okay. So we're going to look at the, you're going to do an internal rotation of the knee by keeping your hip joint, and then an external rotation of the knee. Okay. And that works both ways. So that's adducting toward and abducting and away from. And then I'm going to have you lay back down so that we can do the valgus, okay? So the valgus, I'm going to hold on to your ankle at about a 20 degree and hold on to lateral, and this is to test the medial, so I'm going to shift that way. And then I'm going to test the lateral by holding the medial and twisting to the other way. Watson, 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 Watson. Come on. Watson, Watson. Go lay down. Go lay down. Go lay down. Go lay down. Okay, so that was the varus and the valgus. And then the draw test is that if I hold it at a 20 degree angle and I am anterior and posterior. So I'm pulling on the tibia and I'm pulling. Does that hurt at all?
No.
In any way? Okay. And then the McMurray, the Lachman's test, I'm going to sit on it and just feel by pushing it and pulling it if that's doing anything. Does that hurt at all? Okay, some tenderness there. Okay, so now we're going to do your hips. So if you could stand up, I think we'll take a look at your hips. And I'm having you stand up and down, so I haven't done a very good job of this. But anyway, so I'm going to look at your spine. And I'm going to turn you around. Okay, so I'm looking at I'm looking at the posterior first, and I'm looking at the iliac spine, the posterior iliac spine, which is right up in here. And then I'm looking at the sacroiliac joint, the greater trochanter, and then the anterior superior iliac spine. Okay. Now, if you can, I think we're going to put you down. So I want to, yeah, I'm going to have you down. Okay. So what we're going to do is we're going to do both active and passive. Okay. And we're going to have you flex your hip actively. Okay. Up to a 90 degree. Okay, and then back down again, and then if you can turn on your side, okay, and then that was a flexion, and then we're going to have you come back this way, and that's extension. Watson, Watson, please go away. Okay, go, 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 go. Okay, okay, okay. Watson, come on. I know you love it. There you go. Come on, please, 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 please. Okay, lay down, lay down, lay down, lay down. So what we're going to do with your hip too is we're going to do an abduction and an adduction. Down, down. Thank you. Good boy. Good boy. So you're going to do an abduction and an adduction of your hip. Okay. So what we're going to do is, do you want to do it yourself first? So if you can bend your knee, and you're going to go. That's an abduction, and then we're going to do an adduction. And now I'm going to do a passive. So if you could, you smell. Watson, go lay down, please. Please, please, I'm almost done. Please, I know you love it, Naomi. Please, go. Okay. Now, if you just relax, okay, with Watson, I'm going to do the same thing. So I'm going to do an abduction, and then I'm going to do an abduction. So that's an internal rotation and an external rotation. And we would do it on the other side as well, but Watson is kind of really getting into it, okay? So now what I'm going to have you do is if you can flex your right knee, and pull it towards your chest, okay? And this is the Thomas test, and I'm looking for the back of her spine and to see if her hip is all in line, and it is. And then I'm going to ask you to do the Faber test, which is if you take your left foot, okay? I'm actually going to have you do it on this side because it's easier. So if you flex this and then put it onto your quadricep, okay? And then I'm going to press down on the knee, and does that cause any pain? No? Great, okay. So now we're going to do the spine, and I'm going to ask you to stand up again, because I think that's the easiest way to do that, okay? So I'm going to have her stand here with Watson's tail. Watson, please, go lay down. Okay, so I'm going to have you stand here, and I'm just inspecting your spine, okay? And I'm looking for any redness, any nodules, anything that's jutting out, anything that's there, and that's not happening. I'm also going to look at the cervical, which is convex, and the thoracic, which is, sorry, this is concave, convex, and then concave again, and there's no lordosis. I'm looking at the shoulder height for symmetry, and they are totally symmetrical. I'm also looking at the iliac crest for symmetricity, for symmetrical, and they are. And I'm also looking at the folds, the gluteus folds, and they're equal in the same place. Then I'm going to do the dorsal lumbar spine. So I'm actually going to ask you to bend over and touch your toes. And as she's doing that, I'm looking at her spine, and it is in alignment, and the scapulars are in exactly equal. And if you can come back up, that's great. Okay. And then I'm going to palpate the spinous process and all of the spaces which are between the vertebra, and I'm going to percuss the spine. Is there any pain? Is there any problem with that? Okay. Okay. And then if you can just, it says to sit down, but I'm going to actually do the standing because I think it's, so I'm just going to place my hands on your hips. If you could bend to the right, okay, at about 35 degrees, and then if you can bend to the left at 35 degrees, and then if you can twist your shoulders to the right, yep, at the spine, and that's stabilizing, and then to the left, great. And then if you could do just straight leg raises, and I'm going to stabilize you here, and if you could just do straight leg raises, excellent, and that's equal. Good, and I think we're done. Thank you very much, I appreciate it.
Thank you.
Thank you, Dr. Earl, it's been a pleasure. Sorry Watson was a little bit of a pain.